Antimicrobial resistance so bad. Antimicrobial resistance so bad. It's so bad, it's so bad, 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 it's so bad. It's so bad, it's so bad. Na, 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 na,
Greetings to everyone, good afternoon. My name is Olivia Kobsingi. I'm a member of Antimicrobial Resistance Club at King Caesar University. And as we are aware of the World Antimicrobial Resistance Awareness Week, we are here to discuss a few things about antimicrobial resistance. I'm here with Mr. Basil Okello. Yeah, so he can introduce himself to us and then we proceed.
Well, thank you very much, Olivia, and I am really grateful that you've taken this initiative to come up with such a big initiative at King Caesar. My name is Basil Okello, and I work with King Caesar University. I work in the lab, microbiology lab, as a technologist. I am also a teaching assistant because I'm doing my master's in microbiology. So, thank you.
You're welcome. So, Mr. Basil Okello, kindly tell us about antimicrobial resistance. What do you think?
Well, antimicrobial resistance, I would begin with the antimicrobial is an agent that is able to either inhibit microbial growth or to kill the microbial agents. And then the resistance part of it is that due to overexposure or inadequate use in certain cases, these agents, of course, they develop modes of survival. So they become resistant to these drugs, in that the drug is unable now to kill some populations. Well, some population can die, but others will not be killed. So that is the resistance. And it is a global concern. Globally, the whole world is facing it. But the highest percentage is in poor countries, low and middle income countries, Uganda inclusive. And actually in Uganda, it has been noticed that a wide variety of bacteria are being resistant to most of the medication. From bacteria to virus, for example, HIV, up to even Mycobacterium species, the one that causes pulmonary tuberculosis, as well as some antimalarials are no longer working, for example, chloroquine. So you find that antimicrobial resistance in Uganda is also a notable case that is actually happening, leave alone just from the global view of it.
Yes, thank you so much. Sir, kindly tell us what could be the fate of the health sector in case antimicrobial resistance is not dealt with?
Well, if the patient is unable to get cured because he's infected with an antimicrobial resistant strain of this pathogen, meaning that patient will eventually have to die, or more consequences will have to occur in that patient. So if we cannot kill these agents, and they are spreading, by the way, these infectious agents are spreading to more people. So if we have a large number of cases that we can't treat because the antibiotics can no longer kill the pathogen, meaning we shall have a high case of fertility due to these drug-resistant pathogens that is actually happening. And that can bring about a big loss in the health sector, as well as the economic loss in the country as well. Because in the global view of it, it has been estimated that approximately about 10 million deaths could occur actually by 2050, and also that will or may result into about an economic loss of 100 USD trillion in a nation. And so that's a huge amount of money, affecting both the health sector, in that there will be financial losses, as well as incurring a heavy bad, like the fertility rate is going to be very high due to these drug-resistant pathogens infecting the patients. Yeah.
Thank you so much. Antimicrobial resistance. So, what do you think can be done to curb down the antimicrobial resistance?
Well, according to the Global Action Plan, WHO Global Action Plan on antimicrobial resistance, there are strategic areas that needs to be put in place. One is awareness about this AMR, awareness in both the health sector, coming to agricultural sector, and the environment, as well as the general public must have knowledge of this AMR, and also to be aware of the consequences that can come in if this is not handled carefully. Secondly, improving on preventive measures. You know, we have prevention and control of infectious diseases. So there is need for some improvement in certain areas, because first of all, we are in a poor country, so safe water is not there, there is inadequate sanitation, the things are just not really organized. So we need to emphasize on preventive measures. There is also optimization on the use of antimicrobials on the plan, both by physicians and the patients. There are patients who do self-medication and treatment, like self-diagnosis and treatment. They diagnose themselves of the infection, and also they go to the pharmacies or drugstores and buy this medication, which is not actually very good when we want to prevent what? Antimicrobial resistance. And also generation of knowledge from research and innovation is another strategy that has actually been recommended to be put in place in each and every nation, including Uganda, to curb down this spread and development of resistance.
Thank you so much. Yeah, thank you so much. Antimicrobial resistance. So, antimicrobial resistance as a hazard, really, could you be having some other thing to tell the media?
Well, the WHO speaks about it as a silent pandemic. You know, a pandemic is in a big number of nations are affected altogether.
Yes.
So what I can tell the public, as well as my students, as well as my colleagues at the workplace, is that it is my responsibility and our responsibility, so that we can make sure we reduce on the trend, the rising trend of AMR, to match with the development of new innovations that can come in. Because if the resistance is going higher and we are not developing new drugs, then with time we are going to get out of this medication, and so it's going to be a real problem in modern medicine. So I would say to everyone that it's my responsibility and your responsibility that we can respond to this AMR as quickly as possible.
Thank you so much, Mr. Basilio Okello. Yes, antimicrobial resistance. Let's please be guardians of our antimicrobials. Together we can achieve. Thank you so much.